Which of the following is a component of the pelvic diaphragm? Correct answer is D, levator ani. Which nerve is compressed in carpal tunnel syndrome? Correct answer is C, median nerve. Which cranial landmark is associated with a high risk of epidural hematoma when fractured? Correct answer is C, pterion. A patient presents with CSF rhinorrhea and anosmia after head trauma. Which structure is most likely fractured? It's C, cribriform plate. Which structure separates the cerebellum from the occipital lobes? It's C, tentorium cerebelli. The deep inguinal ring is a common site for which type of hernia? It's C, indirect inguinal hernia. Which nerve is commonly injured in a surgical neck fracture of the humerus? Answer is B, axillary nerve. Which arterial structure is most associated with berry aneurysm formation? The answer is A, circle of Willis. Winging of the scapula results from paralysis of which muscle? Correct answer is D, serratus anterior. Which structure passes through the foramen ovale? Correct answer is B, mandibular nerve. Which artery is a potential source of bleeding during a low tracheostomy? It's D, thyroidea ema artery. Which ligament is most commonly torn in an ankle inversion sprain? It's B, calcaneofibular ligament. Which is a branch of the external carotid artery? Correct answer is A, ophthalmic artery. Which structure passes through the carpal tunnel? Correct answer is D, median nerve. At which vertebral level is lumbar puncture usually performed? Correct answer is C, L3 to L4. Which is a terminal branch of the facial nerve? Correct answer is A, buccal. Which nerve provides motor innervation to the diaphragm? Correct answer is C, phrenic nerve. Which layer of the scalp is considered the danger area due to emissary veins? It's C, loose areolar tissue. Which structure passes through the cavernous sinus itself? Correct answer is C, abducens nerve. Which artery primarily supplies the brainstem? Correct answer is B, vertebral artery. Which nerve is responsible for innervating the muscles of the posterior thigh and the lower leg and foot? The answer is C, sciatic nerve. Which of the following nerves is responsible for extending the elbow, wrist, and fingers? It's B, radial nerve. Which of the following nerves is responsible for extending the elbow, wrist, and fingers? It's B, radial nerve. Which nerve provides motor innervation to the diaphragm? The correct answer is B, phrenic nerve. A 28-year-old male suffers a traumatic injury to his shoulder region. He exhibits weakened shoulder abduction and elbow extension, along with sensory loss over the posterior arm and forearm. Which part of the brachial plexus is most likely damaged? The answer is C, posterior cord. The lesser omentum is an important peritoneal structure in the abdominal cavity. Which of the following structures is not found within the lesser omentum? The answer is D, inferior vena cava. A 50-year-old female presents with difficulty in speech and swallowing. On examination, her tongue deviates to the right when protruded. Which cranial nerve is most likely damaged? Correct answer is C, hypoglossal nerve, cranial nerve 12. Which of the following structures is located in the renal medulla and is responsible for the formation of urine? The answer is B, renal pyramids.